Alright, so this is the syllabus video. I will try to not be forever, but it is very long. Alright, so this is just information about your faculty. It's Greenville and Spartanburg. I've already done the blackboard so you know who we are. We do ask that you don't text or call clinical faculty after 9 p.m. If you call me or text me after 9 p.m., I may or may not answer. My husband doesn't like it, and so I try not to. I usually have it off after 9 p.m. This is a table of contents if you want to just go to a specific part of the syllabus, because our syllabus is ridiculously long. The description. This is what is in the course catalog: evidence-based nursing practice with adults experiencing health alterations, moving from simple to complex states of health, and levels of care. Includes both didactic and clinical instruction. Your prereqs are 306, 308, or you could just have a biology of 370, nurse 310, 320, and then co-requisites are 340, 360, and 375. Here are our outcomes. They come from the Essentials of Baccalaureate Education for the Professional Nursing Practice. There's a link right there if you should desire to go to that link. However, when you're finished with this semester, you should be a critical thinker that applies knowledge from sciences and humanities to patient care situations using the nursing process. An effective communicator who uses therapeutic communication within the nurse-patient relationship and demonstrates clarity in writing skills, well supported by credible literature evidence. So that's pretty important to be able to communicate. Communication is a very important thing in healthcare, so I expect your writing and how you communicate with me via emails to be professional. You should be a competent provider of nursing care who is able to design, implement, and evaluate nursing care to meet the needs of individuals and families, and a professional role model who respects the privacy, dignity, and autonomy of clients and families and demonstrates personal honesty and accountability. Again, being a professional role model is very important. I will talk more about professionalism during clinical orientation, but it is something that we at USC Upstate and all nurses, we should strive to be professional in our daily lives. Course objectives. So at the completion of this course, you should be able to incorporate new nursing knowledge with previously acquired knowledge from liberal arts, sciences, and nursing to plan for evidence-based care for simulated clients and selected health alterations. You should start to function in professional nursing roles of provider of care, collaborator, advocate, and educator for clients with selected health alterations. You should be able to describe the scope of professional nursing practice and utilize selected aspects of health, promotion, disease prevention, risk reduction, maintenance, restoration, and rehabilitation in the prevention and detection of selected health alterations. And you should be able to use the nursing process to plan and implement care for clients with selected health alterations in a structured and unstructured setting. Demonstrate increased proficiency in technical skills, including medication administration, intravenous therapy, central lines, chest tubes, administration of anticoagulant therapy, diabetic care, including blood sugar interpretation and insulin administration. You should be able to think critically to plan for and provide safe and effective professional nursing care, apply ethical, moral, and legal frameworks when providing professional nursing care. You should be able to use communication skills, including oral, written, and information technology to acquire knowledge to plan and implement care for clients with selected health alterations. You should be able to discuss research findings related to problem resolution, clinical decisions, and evaluation of outcomes in professional nursing practice for clients with selected health alterations. You should be able to identify psychosocial, economic, epidemiologic, and genetic influences on clients with selected health alterations. You should be able to participate in collaborative partnerships with other healthcare providers and community members to enhance access to community resources for clients. Participate in an intraoperative experience to enhance understanding of the total operative experience. Demonstrate the ability to identify and teach clients about healthcare alterations, medications, treatments, how to test blood sugar, interpret findings, follow protocols, administer insulin, and prepare meals according to diabetic protocol. Demonstrate accountability for one's own decisions and actions in professional nursing practice. Accountability. Demonstrate responsibility for self-assessment and self-improvement, and demonstrate caring behaviors in professional nursing practice. These are our required texts, the ATI Med-Surg book, the ATI Fundamentals book, and our Honan book. It used to be called Pelico, but now it's Honan. It's the 2nd edition. I guess she got divorced. I don't know. I don't care if you have the 1st or the 2nd edition. Just know that I will be teaching out of the 2nd edition. So if there's a typo, anything about the 1st edition, I'm not going to address it. Texts that are recommended but are not required, but we do recommend them, is a nursing diagnosis handbook, the APA manual, nursing drug handbook, the medicine manual, the Mosby's Dictionary of Medicine, Nursing, and Health Professions, the Diagnostic and Lab Manual, a Saunders Comprehensive Review for the NCLEX RN exam. If you're really struggling to decide what is very needed, I would highly suggest this comprehensive review. Everybody needs one that is going to be taking the NCLEX. And then the book that you had last semester, Fundamentals book. Optional textbooks, Med-Surg Made Incredibly Easy. That should help you with some topics. Required internet resources, the ATI website. Please, please, please use Firefox. ATI does not play well with Internet Explorer, and I don't think it plays well with Google Chrome either. The APA website, apastyle.org. And I have links in the syllabus as well. So, again, I checked them about 2 weeks ago. So, if any of the links are inactive or don't take you to the right place, I need to know so I can fix them. Smartphone applications. Everybody should have some smartphone applications. We live in a smartphone world. So, we have the Clinic Lab Laboratory. It's free. Hippocrates is free. It also has a paid version, but you can get it for free. The Nursing NCLEX RN, NCLEX Exams, and the RN Mentor. The RN Mentor is the ATI version, and then there's NCLEX RN Mastery, and the NCLEX RN Mastery is paid. And I have the NCLEX RN Mastery and the RN Mentor on my phone should you have an interest in them. So please come. I have Hippocrates on my phone too. Should you want to look at them before you get them, you can come look up and I'll show them to you. Online references, the APA style blog, ATI Khan Academy, which is great, and then Purdue OWL. Library resources. So the library has a nursing care plan book, and it's right there. I'm not a big fan of it because I think it's kind of hard to read, which is why I like the book that I have under recommended. But whichever you decide. If you might like the library resource, I don't know. Computer requirements. You all need an operating system that has the most up-to-date Microsoft Word and PowerPoint. Otherwise, you're going to have some formatting issues. As a student, you have access to free versions of these. So I have a little link here. Please click here to get the most up-to-date version. Is it going? Oh my gosh. So when you click that link, you should come to this website, and it will tell you how to install Microsoft onto your computer. So if you need up-to-date Microsoft, there you go. Oops. Also, oops. Spartan Sky access is here, so just click that link. So methods of instruction in the classroom. We will use didactic classroom instruction, including lecture, class, small group discussions, self-learning modules, audiovisual, internet resources, critical thinking exercises, assignments, case studies, and simulations. Ms. Poindexter and I try very hard to make our class interactive, and you need to come prepared to participate in these interactive activities. In clinical, the methods of clinical instruction are going to include laboratory, demonstration, simulation, direct patient care in structured and unstructured environments, clinical conferences, case studies, self-learning, self-evaluation, reflection, role modeling, and use of Blackboard. So that's instruction. How you will be evaluated. Written tests, big majority. Pop quizzes, assignments, classroom activities, case studies, and written assignments. All students must complete the assigned readings before class and to actively participate in class through discussion and interaction. In the clinical setting, we assess your ability to assess, plan, and provide safe and competent care, written assignments, written clinical assignments, and simulation experiences. So the way the class grade is broken down. We have 85% didactic, which is in the classroom, and then 15% clinical. You have to get 75% or overall 63.75 points in the didactic portion for us to put in the clinical portion. The didactic portion has 5 tests that are worth 11% each, your proctored ATI, and your final exam. The final exam is worth 20 and the ATI is worth 10. And it is a fundamentals retake. So I know you took fundamentals last semester. This is a fundamentals ATI version, but not the same version that you took. Then we have the clinical portion, and 75% or 11.25 points to pass it. So you have the 10-minute assessment, which is pass-fail, the sim experience, which is pass-fail, and then you have the ATI modules and quizzes, which are satisfactory or unsatisfactory. So the 10-minute assessment is pass-fail. Everybody's going to pass that assessment. You may not pass it on the first time, but you will pass it before the semester's over with. The simulation experience. Please come to simulation. If you do not come to simulation and you're not prepared, you will not pass. I will open a simulation folder when it's closer to time, like within days of simulation, because we can't open it too soon. We're not allowed to. But you're going to be prepared for simulation. And then you want to have your ATI modules quizzes. Please, 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 please do all of your modules and quizzes. If you do not do a module or quiz, you will receive an unsatisfactory, and that results in a clinical failure, which will result in classroom failure. Your database and concept map, which is 5%. Your surgery observation report, which is 2.5%. Your discussion boards, which are 5%. And your quizzes that are going to be given in class, which are 2.5%. All right. And on the Blackboard video, I showed the grade tracker and how that works. If your grade is 74.9, you will not get rounded up to 75. There is no rounding on failing grades. You will have a clinical performance evaluation, which I will discuss during clinical orientation, so we're not going to worry about it right now. And then clinical makeup is going to be at the discretion of the instructor, which again I will talk about in clinical orientation. I do want to state that receiving an unsatisfactory in a clinical assignment, such as simulation experience or the assigned ATI modules and quizzes, will result in clinical failure, which will result in class failure, regardless of what your didactic score is. And I'm sure I will say it again because I really want you to understand it. All right, this is the ATI assessment and policy. When I did the Blackboard video, I showed it to you. This is exactly where I got it from. So please read through it. You'll get one when you take the ATI proctored exam, and use it as scratch paper, and you're going to put your level and your score on it. All right, so course policies, they are stated in the academic catalog, student handbook, and the Mary Black School of Nursing, and I have links to each. They are going to be adhered to in my class. The Code of Ethics is also something that is it guides all nurses, and that is also adhered to. The Code of Conduct can be found in the Upstate Handbook. We also have a Code of Conduct in the Mary Black School of Nursing, and the Code of Ethics, again, helps guide you. Professionalism. If you have any issues or concerns with peers or instructors, please attempt to resolve the situation yourself, and if needed, to follow the chain of command. So your chain of command: peer, nursing instructor, course coordinator, associate dean, and then dean. Attendance in the classroom. Attendance is not mandatory, but regularity in the classroom is essential. Therefore, regularity is mandatory. So, you must be present 75% of the time. So that's 6 out of the 8 classes before fall break and 5 out of the 6 after fall break, or a total of 11 out of 14 classes. If you're not present 75% of the time, you will receive a needs improvement form. Your expectation or your participation is expected. We want you to be an active listener and an active participant in education, in your education. If you do not actively listen, if you do not participate, you are not going to get anything out of this out of this class. You don't need to be a passive listener. Critical thinking and analyzing concepts that have been covered in the reading is what this class and other nursing classes are focused on. So, you need to have the readings done before you come to class. I tell you what chapters we will be discussing, but it's your job to look at the chapters and to read them. I'm not going to hold your hand and tell you you need to read this page to this page. If I'm telling you that we're talking about this chapter, then you're responsible to know that chapter. Participation includes answering questions on current reading, applying knowledge from previous presentations, initiating discussions, supplementing learning with outside resources, exhibiting a positive attitude, and participating in in-group exercises and promoting an environment of learning. Please be positive in clinical and class. If you're not positive, that just brings down everybody. You should log in daily to see if there's any updates on Blackboard, any announcements. Testing attendance, I will discuss this a little bit more in the classroom orientation, but please understand that if you have to miss a test, we will need some kind of proof. You can only miss a test for exceptional circumstances, such as the death of a loved one, and it has to be an immediate family member. I'm sorry, but all employee guidelines are consistent in this. So a parent, a child, heaven forbid, a grandparent, and we need an obituary that says this. If you are in an unavoidable accident, so a police report, a severe illness, a doctor's note, they have to be verified. We cannot just take your word for it. I'm sorry, but apparently people lie. This proof has to be provided before you can make it up the test. And if you're going to miss a test, don't just miss the test. Now, if you're in a coma, I can understand this. But if a fender bender happened, or you were sick, or whatever, you need to let Miss Poindexter or I know, hey, I am sick, I will not be there. And it needs to be in a reasonable amount of time. Please don't, we worry. If you're not here, we are worried about you. So, we need to know these things in a reasonable amount of time. So, give us a heads up, like at least a couple of hours late, that's fine, but give us a heads up. The school requires absentee notification and documentation submission of absence for illnesses and other unforeseeable events for scheduled quizzes or exams. Therefore, if a student misses an in-class quiz or examination, adequate documentation must be provided. Makeup tests for scheduled and unscheduled pop tests will only be given to students who have experienced extenuating circumstances, which results in their inability to miss. If a student needs a test early, it will be the course coordinator's discretion. A late test will not be scheduled unless there are mitigating circumstances. All right, clinical. A clinical attendance is required. Please do not miss clinical. Clinical is where you're going to get your hands-on experience. And missing clinical is like a serious missing clinical will be a serious disservice to yourself. If you miss more than one clinical, you'll be withdrawn from the course. No ifs, ands, or buts. Absences are to be made up at the time determined by the faculty. In the event of an illness or inability to attend, you need to notify the instructor and the charge nurse on the unit where the clinical practicum is held. Students are expected to be punctual and to arrive on the unit with sufficient time to assure their assigned client is still in the unit, double-check orders for critical medicines, and review any changes in the chart. You should not be later than 6:30. 3 tardies after scheduled start time in the clinical area are considered an absence. And again, the clinical performance evaluation we will talk about in clinical. The needs improvement form is right here. I hope I don't have to give any out, but I've given them out in the past, so I'll probably have to give them out this time too. So the needs improvement form. The needs improvement form can be given for anything from being late to clinical to poor behavior in class to being regularly absent from class. They can be given for a lot of things. The needs improvement form is going to include your name, the date that this happened, whoever the supervising instructor was. So if it happened at clinical, it could be Miss Lanier or me, whoever the coordinator is, which is me, what the problem was, and what the remediation plan is. And then if the remediation plan includes, like I know that sometimes people have acted unprofessionally, and maybe they had their cell phone at clinical. Well, they got a needs improvement form, and their remediation plan was to do a 2-page paper on the importance of professionalism in the workplace. So then if there was a date for such an assignment, then it would go right there. And then it's signed by you, me, and whoever else is the the supervising instructor, if it was not me. Withdrawal. You need to look at the policy in the academic catalog and the Mary Black School of Nursing. For nursing classes, you have 2 attempts. So if you withdraw from a nursing class before the withdrawal date, you have a second attempt. Like that W will count as your first attempt, just like a failure counts as your first attempt. The grading scale is right there. All right, online electronic communication. I feel like I have to go over this because people have not done this correctly. So, anytime you're communicating with a faculty member, you need to be professional. So, whenever you post messages on the course discussion board or you're sending emails, please follow these guidelines. Always include in the email, if you're emailing, the class and the topic that is concerning you, because Ms. Poindexter and I teach more than one class. So we need to know which class is talking to us. I work very hard to learn all your names. However, still need to know which class it is. Always start your message with an appropriate salutation. Be mindful of the tone of your message. Please do not send an email or post a message on the discussion board when you're angry or upset. You need time to clear your head and to think about what you're going to say. That will be read. Like, it will be read if you're angry. Like, we can tell if you posted that message with anger in your heart. Do not type messages in all caps, because that can be perceived as shouting. Please use complete sentences, correct grammar, correct spelling, and punctuation. Carefully review your messages before posting to the discussion board or sending by email. I read my email like 3 or 4 times before I send it because I just want to make sure that it sounds okay. Miscommunication occurs a lot in electronic writing because if people don't get the right tone, then they don't get the right tone and they misinterpret what you're saying. And always sign using your first and last name to avoid any uncertainty about the author. Having an email address is not always sufficient. All right, testing behavior. Again, I'll probably talk about testing behavior on Friday as well, but we do our very best to stimulate the NCLEX environment. So the following rules apply when you're in the testing center. Quiet zone. The hallway into the computer room, that is considered the quiet zone. Please do not talk or discuss anything testing related once you are in that area. If you feel like you need to talk, please do it outside the testing area. A lot of students get anxious when you are talking about the test that they are about to take. They don't do well with that, so no talking in that area. No cell phones, book bags, books, watches, hats, drinks, food, or any other personal belongings. These items need to be kept in the trunk of your car. There is not enough room to leave these items on the periphery. It might be with small class size, but like people trip over these things all the time because there are so many. Now you have like a 45-minute window from testing to class, so surely you can walk out to your car and get your material. Please only ask computer-related questions of the instructor. We are not allowed to interpret a test question. So if you don't understand the test question, I am so sorry. You can write down that question that you didn't understand, and we can explain it to you after the test, but we cannot translate it during the test. And allow extra time to enter the testing center because 85 is hellacious, and we don't need to allow for like just right on time. You might need to allow for a little extra time. All right, so late assignments. APA format will be utilized for written documentation, such as the OR report. You are in a baccalaureate program, so you need to use correct grammar and spelling in your writing. It affects your grades on submitted coursework. Again, read the rubric because it's in the rubric. Consequences of submitting an assignment late are at the discretion of the advisor, but anything that is submitted late, you will get 3 points off for each day, or 3%, 3 points. It's up to 3 days, and then after the 3rd day, we generally won't take an assignment. It's at the discretion of myself or Ms. Poindexter. We do count weekends and holidays in that 3 days. Everything needs to be submitted via Blackboard, and it will alert us if it's late because we have due dates set on there. So please pay attention to that part of the syllabus. Academic dishonesty. Students who admit responsibility or who are found responsible throughout the Student Code of Conduct will receive the appropriate grade determined by the professor, which may include an X to signify academic dishonesty. Grades with an X are not subject to grade forgiveness. Please don't be dishonest in your work. Don't plagiarize. Just do your work. If you want to learn more about the Academic Integrity Code, please follow that link to the student handbook. Plagiarism. Oh my gosh, plagiarism. So plagiarism is the use of ideas without appropriate citation or credit to the author. This includes word-for-word quotes from texts, journals, websites, or any other sources used by the student without using quotation marks or citing the work. It also includes close paraphrasing, using the same words and phrases to convey an idea without using appropriate quotations. This involves all sources, including textbooks, websites, journals, etc. Plagiarism is theft and cheating, and it will not be tolerated. Assignments are to communicate the student's understanding of the knowledge, not to express someone else's ideas. Inability to express ideas or knowledge indicate a lack of understanding of the material. Excessive quotation, with or without proper citation, does not convey knowledge and will result in a poor grade. The Mary Black School of Nursing adheres to the guidelines, policies, and procedures established by the Academic Honor Code for USC Upstate. According to the Academic Honor Code for USC Upstate, students are on their honor to not cheat, plagiarize, lie, steal, bribe, and report anyone they see violating these policies to the instructor or the Associate Chancellor for Student Affairs. For example, the obtaining of information, written or oral, during a test and or exam, or misrepresenting another's work as one's own, copying of required work, i.e. nursing care plans, interaction paper, teaching learning plans, or the giving of such information will be considered as an infraction of the academic code. The specific procedures and policies for reporting any of these violations are found in the USC Upstate Handbook under Code of Student Responsibility. Students who admit responsibility or who have found responsible through the Student Code of Conduct will receive an appropriate grade determined by the professor, which may include an X to signify academic dishonesty. Grades with X's are not subject to grade forgiveness. And if you have an X on your transcript and you want to go to a different school, they will know what that means because that is universal. So, links to both handbooks should you choose to look at them. Standardized Achievement Test. Standardized Achievement, ATI, will be given at the end of the semester. Your score will count 10% of your final grade. Any clinical class has an ATI. Students must complete the assigned ATI practice test, so you need to look at the course schedule for that. To take the ATI specialty exam, you will need to perform a focused review regardless of the score in which you make. So regardless of what you make, you need to make a focused review. For the practice, it is a minimum of 1 hour. Doesn't mean that you can't spend more, and I highly suggest it. The focused review for practice B will be placed based on your first grade. If the focused review is not completed by the deadline noted, you will not receive those points. So focused review expectations. If you make a below level 1, you will get a minimum of 4 hours. Level 1 is 3, level 2 is 2, and level 3 is 1. So, on the proctored ATI, these are the times that you will need to spend in your focused review. For the practice ATI, it is just a minimum of 1 hour. But if you make a below level 1 on your proctored ATI, you need to have at least 4 hours of focused review time. The longer you spend in your focused review on your practice, the better you will do on your proctored. I suggest doing really badly on your practice. So, even if you make a 100 on your practice, because I have had students do that on their practice, you are required to do your focused review, and it is still an hour. Student handbook, please refer to the rounding rules. We're using ATI for our drug calculation now, and ATI pretty much tells you what to round to. Let's see, you have to get a 95%. If you don't meet the drug competency, you have to withdraw. So hopefully everybody will do well. The Code of Conduct and Disruptive Behavior. Students are advised to bring their Pelico, Onan now, ATI text to class each day or have access to a digital copy. Arrive on time. Breaks are given at appropriate intervals. You can use laptops during class for note-taking and exercises. I will call you out if I see you surfing on the internet during class time. Like, just expect it. You want to bring an electronic device to all classes for participation in exercises. Please refrain from talking during class as this is disruptive to your peers. and personal computers and cell phones are not permitted in the clinical area. You must also abide by the code of conduct set forth by USC Upstate and Mary Black School of Nursing. Please refer to the handbook for both. If you have a disability, please let us know on the first day that you are getting accommodations from the disability office so that we can follow up on it, because our first test is 2 weeks out. So if we don't have that information, we cannot accommodate you. So USC Upstate supports the ongoing development of an accessible university that embraces diversity through educational programming services, resources, and facilities that are usable by all members of the campus community. In keeping with university policy, any student with a disability who requests academic accommodations should contact Disability Services to arrange an appointment with a staff member. Students are encouraged to seek an appointment as early in the semester as possible so accommodations can be given, because they are not provided retroactively. It is the responsibility of the student to provide these letters to professors promptly so that accommodation may be put in place. Testing center information, which is mainly for the Spartanburg campus, so I wouldn't worry about that part. This is about the requirements. You must comply with immunization requirements of the Mary Black School of Nursing before starting clinical experience. They can include CPR, OSHA, HIPAA, medical requirements, immunizations, having health insurance, passing drug calculation exam, and other requirements specific to the clinical agency. Unsafe practice. Unsafe practice. Students may consider the following as unsafe. Any of these violations may result in being removed from the program. Failure to use the nursing process effectively, demonstrated by such behaviors as lack of knowledge of the client's diagnosis, treatments, or medications, failure to follow safety precautions for clients, acts of omission or commission, including documentation of care. Attending clinical laboratory while under the influence of alcohol and drugs, please do not. Working the immediate shift before clinical, please do not work that for clinical. Failure to recognize the impact of own attitudes and behaviors on the care of clients, deliberately giving false or inaccurate information regarding nursing care, failure to assume responsibility for completing nursing care, performing interventions without adequate preparation or needed supervision, violation of HIPAA, which includes digital copying or Xeroxing of patient records. A violation of HIPAA will result in immediate expulsion from the course. The dress code. Oh, goodness, the dress code. All students are required to wear the official USC Upstate student nursing form while in the clinical setting and simulation lab. So anything that is pertaining to clinical, such as clinical orientation, sim lab, the hospice visit, or clinical, please wear your uniform. All right, so the clinical uniform needs to include a green scrub top with logo, black scrub pants, black shoes. You can also have your scrub jacket. It has the USC Upstate logo on it, if you so choose to wear that to clinical. It is not mandatory, however. So you can wear it if you want. You don't have to wear it if you don't want. But you do need one at graduation, or pinning, or the ceremony, the graduation ceremony, I should say. So if you don't get one, you have to have one by then. You also need to have clean and trimmed fingernails. They can't be long fingernails. They can't be polished. And your hair is supposed to be high and tight. Nothing dangling off your face, no rings, no facial piercings, nothing like that. And then this last part is just the course content, which you can read on your own. But it's like all the concepts that we will be covering. All right, so I hope I've answered everything. I apologize for this video being so ridiculously long, but the syllabus is long, so not much I can do about it. After you view this video and the Blackboard video, you should be able to take the Blackboard quiz. It is a pass-fail thing. It's not added into the grade book. You need to make 22 points to get 75% or better, and it is multiple attempts. So If you have any questions about anything, please email me or call me. Thank you.